It's finally here, the swine flu vaccine. The first doses have arrived in Indiana and Tennessee for healthcare workers. It's the initial dribble of what will turn into a tidal wave of supply that could inoculate over half the population of the United States. It is Monday night, and the big story on Action News tonight is the arrival of the first H1N1 vaccine. Action News reporter Katherine Scott is tracking the vaccine supply side. And of course, Katherine, the big question here, what about Pennsylvania, New Jersey, and Delaware?
Well, Jim, I'll tell you about them. Here's the flu situation update from the Centers for Disease Control. It includes both seasonal and H1N1 influenza in the activity levels as we take a look at the map here. In Pennsylvania and in Delaware, they say the virus is widespread, whereas in New Jersey, they say it's more of a regional issue, which means pockets of the state. But throughout our region, the first shipments of the vaccine are arriving this week after months of preparation.
People are really scared. There's a lot of hype.
Dr. Berger saying his practice, Center City Pediatrics, has been getting calls every day for months. Parents wanting to know when their children can get vaccinated for H1N1. The first doses in Pennsylvania will go to kids ages 5 to 9. In New Jersey, ages 2 to 18, and in Delaware to healthcare providers. Yet despite the rush to get vaccinated, some people are concerned about the vaccine's safety.
It's not like this is truly a new vaccine. What they're doing is they're just putting some new components into it. So I don't think that people should be afraid to get it because they think that their child is going to be a guinea pig.
Mid-month, Philadelphia schools are planning to hold free and voluntary vaccine clinics for children. But the vaccination isn't optional for some healthcare providers. At the University of Pennsylvania, for example, where both seasonal and H1N1 vaccinations will be mandatory.
So we think it makes it a safer place to get care and also a safer place to work.
At a new growing practice like Dr. Berger's, they ordered 800 doses, though they're not sure if that will cover all who request it. As for how to prioritize the first patients, they're awaiting word from the Philadelphia Department of Public Health.
In terms of deciding how to triage the doses, we haven't heard that. I'm hoping maybe they'll give us a little insight into that tomorrow.
And tomorrow is when Dr. Berger says the Philadelphia Health Department will host a teleconference that he's hoping will shed more light on which patients get priority. Jim?